Good afternoon, everyone. Thank you for joining us. As usual, I'll start with the most recent statistics on COVID. I can report that an additional 22 positive cases were confirmed yesterday. That represents 0.7% of those who were newly tested yesterday, and it takes the total number of cases in Scotland now to 18,580. Now, the Health Board breakdown of these new cases will be available later, but my provisional information is that 14 of the 22 are in the Greater Glasgow and Clyde Health Board area. And I've also been advised that a possible cluster of cases is currently under investigation by Greater Glasgow and Clyde. An incident management team meeting will take place later this afternoon, which I hope will give more detail, and an update will be provided after that. But I want to give an assurance today, as I always do, that all new positive cases are thoroughly investigated for any links, and Test and Protect, of course, gets to work to make sure that all contacts are appropriately traced. I can also report today that a total of 260 patients are currently in hospital who have been confirmed as having the virus. That is 4 fewer than yesterday. And a total of 2 people last night were in intensive care with confirmed COVID, and that is no change on the figure yesterday. I thought it was also worth, though, pointing out today our information that there has been no new COVID admissions to ICU in Scotland since the 9th of July. So that is, I think, a further positive indication of the position we have right now, although, of course, we mustn't be complacent about that. And finally, I'm very pleased to say that yet again during the past 24 hours, no deaths were registered of patients confirmed through a test in the previous 28 days as having COVID-19. And the total number of deaths under this particular measure, therefore, remains 2,491. In addition, though, National Records of Scotland has just published its regular weekly report, and like the daily figures, it includes deaths of people who have been confirmed as having COVID by a test within the previous 28 days. But the NRS report also covers cases where the virus has been entered on a death certificate as a suspected or contributory cause of death, even if its presence wasn't confirmed by a test or if the test had been more than 28 days previously. That is a wider measure and therefore captures more cases. And between our daily figure and the NRS report, let me be very clear that all deaths that are associated with COVID, either on a confirmed basis or suspected or contributory, are captured and reported. The latest NRS report covers the period to Sunday the 26th of July, and let me remind you at that point, according to our daily figures, 2,491 deaths of people who had tested positive had been registered, but none of those deaths had been registered in the 7 days up to Sunday. Today's NRS report shows that by Sunday, the total number of registered deaths with either a confirmed or presumed link to the virus was 4,201. Of those, 8 were registered in the 7 days up to Sunday, and that is an increase of 2 from the week before. National Records of Scotland has also reported that the total number of deaths recorded last week from all causes, not just the virus, was 24 lower than the 5-year average for the same time of year. Now, I want to say just a word or two more about the fact that the number of COVID deaths rose very slightly last week, especially given that we reported no deaths at all over that period in our daily figures. 4 of the 8 deaths reported by NRS were in hospital, 2 were in care homes and 2 were in other settings, for example, at home. Now, the reason why the 4 deaths in hospitals weren't captured by our daily figures is that these daily figures, as I've mentioned already today, record people who have died within 28 days of testing positive for COVID. However, some people who test positive receive care for more than 28 days afterwards, but sadly, some of them don't manage to recover. So if these people die after the initial 28 days but have COVID recorded on the death certificate as a contributory factor, then they would be included in the NRS report, but not in the daily figures. But again, that's to give you an assurance that all deaths associated with COVID are being captured and reported between our daily figures and the National Records of Scotland report. Now, I want to make just 2 more general points about today's figures. First, obviously, any increase in deaths, however small it might be, is regrettable and very unwelcome. But when we have very low levels, as thankfully we do right now, fluctuation is to be expected. However, the second point is this one. These figures are a reminder of the continuing impact of the pandemic and of the fact that despite the progress we have undoubtedly made, we should never underestimate how cruel a virus this can be. We've always got to remember that every single life lost to this illness is of an individual who's been mourned by friends and loved ones. And I want to send again today my condolences to everyone who is grieving as a result of COVID. I also want, as always, to thank our health and care workers for the extraordinary work you continue to do in what remain very testing circumstances. You have my and the entire Scottish Government's gratitude for that. Now, I have two issues I want to briefly update on today, and both of them relate to further improvements to our presentation of COVID data. We've had some discussions with the other nations of the UK about providing regular and consistent reports on the distribution of personal and protective equipment, PPE, and our first report will be published on the Scottish Government website today. That shows that in the past week alone, more than 16 million items of PPE have been distributed across Scotland by National Services Scotland. These include almost 12 million gloves, 3 million masks and nearly 1 million aprons. And in total, since the 1st of March, more than 362 million items have been distributed. Now, these figures give some idea of the scale of the ongoing work to ensure that health and care workers have the equipment they need to keep them safe, and I'm grateful to everyone involved in that effort. In addition, from 2 p.m. today, Public Health Scotland will be presenting a much wider range of COVID information on its website, and doing so in what I hope you will find to be a more accessible format. It will publish a new COVID dashboard, which will include summary data of recent cases and deaths, broken down both by Health Board and by local authority area. It includes much more detailed information according to the date of someone's test result and also the date on which people have sadly died. So you can, for example, find out exactly how many women or men within a certain age range tested positive in Scotland on a specific day. We know from the information requests that we received that there is a desire from many people to have easier access to more detailed data about the pandemic, both in terms of the current position and, of course, the risk that we will continue to face in the weeks ahead, but also in terms of how the pandemic has developed over the past few months. And we hope that the new dashboard will help anybody who is interested to see data about the pandemic in their area or across the whole of the country. One of the features of the dashboard is that it will use local data to colour code local authority areas based on the proportion of neighbourhoods which exceed 55 confirmed cases per 100,000 over a 7-day period. Now, an average size neighbourhood on the map, which would have about 4,000 people, would need to have 3 cases in the previous week to exceed that limit. Now, I should say that figure is considerably higher than the current prevalence of COVID in the population. So, in contrast to at the peak of the pandemic, many local authority areas are currently likely to be showing as having no neighbourhoods above that threshold. But that should not be taken as an indication of no cause for concern or a signal to any of us to be complacent. And I want to stress that very clearly. The new figures will show, as the figures I report every day right now thankfully show, that COVID is at low levels in Scotland, and we've all worked very hard to get to this position. But we also know from the case numbers I've reported today, for example, that the virus is still circulating in Scotland, and the clusters we have seen and will undoubtedly continue to see demonstrate how quickly the virus will spread again if we give it the opportunity to do so. In addition to that, as I was talking about yesterday, news reports from other countries in Europe and across the world remind us how easily progress against COVID can start to go into reverse. So for that reason, when I announced the outcome of the Scottish Government's formal review of the COVID restrictions in Parliament tomorrow, I'm likely, very likely, to adopt a very cautious approach. We have made very significant changes over the past 3 weeks, including the resumption of indoor hospitality and tourism. And it is still too early to be completely assured about the impact of these, or hopefully the absence of impact of these. And we also intend to make some very major changes over the next 3 weeks. For example, I hope that I can confirm tomorrow the pausing of shielding at the end of the month. And as you know, it is our central objective for the next 3 weeks to get schools back full-time from the 11th of August. Ensuring that those changes can take place without raising the prevalence of the virus too far is not going to leave us very much room for many other immediate changes. And I know that sometimes what appear to be anomalies right now and what is allowed and what is not allowed can be confusing, although I would assure you that there are rational explanations for what might appear on the surface to be inconsistencies. But more fundamentally, and this is a key point that I want to leave you with, we can't just look at whether an individual change is safe, although that is an important part of our consideration. We also have to consider the cumulative impact of all of the changes we make, and we have to be sensible about the order in which we make changes so that we don't create a situation where we are doing too much too quickly and therefore giving the virus the chance to overwhelm us again. So there will be, I am sure, parts of our economy and people who will be disappointed tomorrow if changes they want to hear are not happening as quickly as they would like. And I recognise that, and I am genuinely, as I always have been, sorry about that. I don't relish any of the implications and consequences of what we're dealing with right now. But where we are unable to move to a further opening up tomorrow, we will indicate as far as we can indicative dates for the future, even although they will be conditional on continued suppression of the virus. And as ever, the decisive factor in ensuring how quickly we can make further changes in the weeks ahead will be how successful we continue to be at driving this virus to low levels and indeed keeping it at the low levels we see right now. And as ever, that depends on all of us. Each and every one of us have to ensure that we do everything we can to avoid creating opportunities for the virus to spread. What I'm about to say, firstly, you've heard me say it before, and secondly, it is not intended as a criticism. We're all human beings, even the politicians amongst us, and human behaviour is very instinctive. And I know, anecdotally, I know from my own observations, and I know how hard it is in my own life, that some of the things that we've been getting used to doing for the past 4 months, physical distancing in particular, we are all perhaps beginning to just drop our guard a little bit on these things. And this is a moment, and I say this directly, and I really do say it from the bottom of my heart, it is a moment for all of us just to pause and think about whether that is the case. And if we are dropping our guard and letting those standards slip, to give ourselves a bit of a shake and make sure that we do all of the things that we are being advised to do rigorously in the period ahead. And that, of course, is encapsulated in the facts advice that I always end with, and I'm going to end on today. Please wear face coverings. It's mandatory, as you know, in shops and public transport, and I think we're seeing high levels of compliance with that. But in any enclosed space where you might be finding it more difficult to physically distance, wear a face covering. It gives an added bit of protection against transmission. Continue to avoid crowded places, even if they are outdoors. Crowded places, wherever they are, increase the risks of this virus spreading, so avoid crowded places. Remember to clean your hands and clean any hard surfaces that you're touching. This one will be cleaned after this briefing today because the virus stays around on hard surfaces and we know it can spread through lack of hand hygiene. So clean hands, clean hard surfaces. Keep a 2 metre distance. And I think this is the one, probably more than any of the others, that we've all got to check ourselves on. Keep a 2 metre distance. Unless you're in a premise where there is a permission to go to 1 metre with appropriate mitigations, the general rule remains 2 metres. And lastly, self-isolate and book a test if you have any symptoms. Test and Protect right now is performing, I think, well, and those who are working through Test and Protect are doing a sterling job when outbreaks and clusters appear. But they need the cooperation of each and every one of us. So please make sure if you are experiencing a new cough, a fever, or if you are aware of a change in or loss of your sense of taste or smell, then you self-isolate immediately and you book a test immediately, because that helps Test and Protect do its job. If we all follow all of these things, we don't take away the risks of this virus. Unfortunately, it's not that simple, but we do significantly reduce those risks, and we collectively try to protect the progress that we've made and hopefully keep that progress and keep this virus firmly under control. So my thanks to all of you for listening. I'm going to hand over now to the Finance Secretary, who's going to say a few words about our economic interventions. I'm also joined by the Chief Nursing Officer, who will help us then answer questions from journalists. Kate.
Great. Thank you, First Minister. The economic implications of coronavirus continue to be significant, and we'll continue to act as quickly and as decisively as we have done throughout the pandemic to support businesses and to protect jobs and livelihoods. We've put in place a package of support worth more than £2.3 billion, and having visited some businesses just this week, like the Isle of Skye Candle Company, I know just how critical that financial support has been to countless businesses the length and breadth of the country. In many cases, it has enabled them to survive and then to reopen when it was safe to do so. Our support to date has taken into account the specific needs of Scotland and our key sectors. That tailored approach is continuing as businesses safely reopen, and today we are setting out details of further support for our tourism industry, recognising the huge contribution that it makes to our national economy. The most significant element of today's announcement includes a £14 million hotel recovery programme, which will help to secure up to 3,000 jobs in the sector. This programme will be managed by our enterprise agencies and Visit Scotland. It is comprised of £9 million of revenue and £5 million of capital. Its core purpose will be to protect larger hotels, which have been badly impacted by the events of the recent months. It will also help to keep staff in work until the new tourist season starts in 2021. This is also about looking forward, and successful applicants will be offered wraparound support to help strengthen their companies for the future. We expect the fund to be open for expressions of interest by the end of August. Today's package follows on from the £4 million of investment that we announced for independent museums and galleries on Saturday, and the £10 million of support for the events sector that was detailed on Sunday. Each of these funds recognise the challenges facing specific sectors. When taken as a whole, those funding streams will help to secure jobs across the country and will give some certainty for our key industries in the coming months. We're fully committed to supporting businesses, and we're doing all that we can to anticipate and respond to their needs as quickly as possible. We're acting now, listening to businesses, designing support and ensuring that funding gets to those in need. I've said before, and I will say it again, we could do more for even more sectors if we had additional fiscal flexibilities, such as the ability to borrow, which most governments around the world have. I was pleased to meet the Chief Secretary to the Treasury last week and discuss our financial pressures. The additional new funding announced last week by the UK government is welcome. We are in unprecedented times, and managing uncertainty within a fixed budget is challenging. Most other governments will overspend this year because they have borrowing powers. Those powers are still withheld from the Scottish Government. If we're to meet the ongoing challenges of COVID-19 as well as to support economic recovery, the need for additional fiscal flexibilities has not gone away. That's recognised by my counterparts in the Welsh Government as well as the Northern Irish Executive. And although I'm disappointed that we have not as yet reached agreement with Treasury on those fiscal flexibilities, I will continue to constructively engage with them in good faith. We've got a vision as we emerge from this pandemic for strong and inclusive economic growth that focuses on job creation. It must be a national endeavour, working closely with employers, businesses and enterprises, the people that are creating jobs and adding value to our economy. Having spoken to countless businesses in the last few weeks, I know that many have been through the most difficult of times and the outlook is still uncertain. We'll do all that we can to provide support, to provide funding and to provide guidance, as evidenced today with this latest funding package. Thank you.
Thanks, Kate. We'll go now straight to questions. Andrew Kerr from BBC Scotland.
Thank you, First Minister. Labour say the BBC's care home scandal programme last night should shame the government into action. Why was a proper in-depth interview on such a pivotal issue declined? And as Westminster's Public Accounts Committee chairman says the care home sector in England was thrown to the wolves, is that what happened in Scotland? And just secondly, on another issue, would you support airport testing in Scotland, and would this mitigate the need to quarantine? Thank you.
Okay, thanks, Andrew. On the care homes issue, I watched the documentary and it raised very important issues. What I'm about to say is not intended in any way to underplay the importance of those issues, but it didn't raise a single issue that I have not stood here day in and day out over the past 3 months, more than that now, answering questions on. And I will continue to do that for as long as it takes. There are only so many hours, even for me, in every day, and I have to prioritise my time and the time frame available there. It wasn't possible for me to do a specific interview, but I don't think even my harshest critic would say reasonably that I haven't subjected myself to a great deal of scrutiny, as people have a right to expect of me on every aspect of the handling of this pandemic, and I will absolutely continue to do that. On the substantive issues, as I say, all of these issues have been raised rightly and properly on many occasions over the months. I've said openly before, we took decisions around care homes as we took decisions on every aspect of the handling of this virus in good faith, based on the best evidence and advice that we had at the time. We will have made mistakes on all aspects of the handling, and I refuse to be defensive about that, although I absolutely accept that I am accountable for that. But some of the things that people will look back now and say were mistakes will be things that we is views that are being informed now by things we know now that we didn't know then or didn't know as clearly then. And that is in the nature of dealing with an infection like COVID that we haven't dealt with before and still don't understand to the fullest extent that we would want to. We will all have a need to, and for people like me, a duty to learn lessons and to be accountable for every aspect of that. And I don't shy away from that. But all of these issues are addressed on an ongoing basis. We have changed certain aspects of how we deal with the pandemic in care homes, as we have changed certain aspects of how we deal with the pandemic in all things, as evidence has changed and developed, and as the advice has changed and developed. And we will continue to do that. And we, of course, now see levels of COVID and numbers of deaths reflective of the situation across the country at much, much lower levels in care homes. And the absolute focus now is to make sure we keep that focus to ensure that it doesn't run out of control there, just as we don't want it to run out of control again anywhere else. On the issue of airport testing, I addressed this issue yesterday at the briefing. When we first talked about the decisions we were taking around quarantine a few weeks ago, I said then that we would be wanting to explore alternatives to quarantine if they were going to be effective, either complete alternatives or possibly more likely partial alternatives. So we're not close-minded to that, but we have to be very rigorous in our assessment of whether an approach, for example, of testing at particular times when somebody comes into or back to the country, whether that would be as effective as a period of 14-day quarantine, or whether actually we run the risk of allowing more cases to slip out into the community and potentially seed community transmission again. One of the things, and I said this yesterday, that is a challenge around any infectious disease, but is a particular challenge in our handling of COVID, is that the incubation period can be quite long, up to 14 days it's thought the incubation period can be. So even if you're certainly testing somebody just when they come into the country doesn't give you an assurance that a negative test means that person isn't incubating COVID. And even testing, which I understand is under consideration by the UK government, at 8 days doesn't give you absolute assurance that there is not still an incubation period. So these things are always a balance, but we need to look carefully at the balance of risk, and we will continue to keep all of these things under review. Sharon Donaldson from STV.
Minister, about education. There are 2 surveys out today showing concerns from parents and from pupils about the lack of schoolwork being done during lockdown and their general well-being. I wanted to know what your reaction is to those surveys and what you plan to do to tackle this problem.
I've not seen the surveys, I've not had a chance to look at them in detail. I will certainly do that. But what you've said to me there does not in any way, shape or form surprise me. I am deeply concerned about the impact of the handling of COVID and the impact of lockdown on the education and well-being of our children. I think anybody would be, and obviously parents in particular are concerned about that. We have sought to minimise and mitigate that impact all along the way, but our key objective now, which is why on other things tomorrow you probably hear me being a lot more cautious, is to get children back to school full-time from the 11th of August, because I think that overwhelmingly is in the interests of children and young people. And if that means that some of the rest of us have to continue to make some sacrifices around other things that we would perhaps love to be doing but can't do for a period, then that will be in the interest of making sure we get young people back to school. And that is the driving focus of everything the government is trying to do around the overall management of this pandemic right now and for the next few weeks, because it does depend on keeping levels of the virus very, very low. Fraser Knight from Global.
Minister, just firstly on the cluster, the possible cluster you spoke about in Glasgow, I was wondering if, I know you said there's a meeting taking place later, but is there any more details you can give us on that? Is it contained to like one workplace, or is it something that people should be looking out for in pubs and restaurants? And just on, holidays, yesterday you said that you wouldn't be booking a holiday abroad just now. Some people that we've spoken to have said that that was quite strong language, which has made them feel guilty for going on holiday, especially if they've booked it a year in advance and have thousands of pounds at risk that, you know, if they didn't go on holiday, then they would lose. I was just wondering, do you think people should feel selfish for going on holiday?
Okay, on the first question, I'm not able to give more information on the cluster, or rather the possible cluster that is under investigation right now. It wouldn't be helpful for me to give information before the incident management team meeting has happened, and I've got more solid detail than I have at the moment. I was advised that this possible cluster was being investigated last night. I know there's been a problem assessment group looking at it, but we need a bit more information. It is the information I have just now is that it has been associated with a particular location. I'm not going to get into the detail of that right now, but part of the challenge we have around any potential cluster is to make sure everything possible that can be done to minimise onward transmission is being done. So I can't stand here right now and tell you that there is no risk of onward spread. If I was satisfied about that, it wouldn't be a potential cluster that was under investigation. So we will put more information into the public domain as soon as we can, if there is an issue that is genuinely one causing concern and needing to be investigated. And people can cast their mind back to the Lanarkshire outbreak last week, to Dumfries and Galloway a couple of weeks before that, to get a sense of the kind of things that will be going on and the kind of information that we will seek to put in the public domain, should that prove to be required. I mentioned it today because the majority, based on my provisional information, the majority of the new cases today are in Greater Glasgow and Clyde. They may or may not be associated with this potential cluster, but given the number there, I think it was important to mention that, and also to give an assurance, again, that any suggestion of any links between cases, any possible clusters or outbreaks, are absolutely rigorously explored, investigated and dealt with, and action taken where necessary. On the point about holidays, Fraser, I don't want anybody to feel guilty about any aspect of this. It's not anybody's fault that we're dealing with a global pandemic. It's not the government's fault, although there are many aspects of how we handle it. I'm sure that people will have views, good or bad or indifferent over, but this is not something anybody should feel guilty about. You should absolutely feel responsible about doing all the right things, washing your hands, keeping 2 meters distance, wearing face coverings, because these are just things that as citizens, all of us have a responsibility to do to keep the virus low. I am not judging people for whether they're going on holiday or not, but I have a duty as First Minister to make sure that if you are going on holiday, it's not something I'm going to judge you for, but I want you to be aware of the risks. I want you to know that if you go on holiday, if you book a holiday now, just because the country you're going to looks as if it's fine in terms of COVID, it's not on the quarantine list and there are no particular restrictions in place in the country, there is no guarantee that will continue to be the case while you're there. The country could have an outbreak and impose new restrictions, and you could find yourself, for example, confined to your hotel. Or the UK, Scotland included, might have decided to reimpose quarantine by the time you come back. So all I am doing is trying to give people the information. And I expressed a personal opinion yesterday. I'm not able to book a holiday right now for obvious reasons. But taking all of that into account, my individual judgment right now would be probably not to book a foreign holiday. If I had some time off, I would choose to go and spend it in Scotland, and it would give me the added advantage of being able to help the Scottish tourist industry. But that's my personal judgment based on the information. All I'm doing is giving everybody else the same information I've got so that you can reach those judgments for yourself. And I'm not judging anybody. I'm not asking anybody to feel guilty. I just want people to be informed right now, which I hope is something that, whether you agree or disagree with the judgments I'm making, you at least understand that it's important to have the information to base those decisions on. Alan Smith from Birr.
Thank you, First Minister. On the issue of weddings, our station West Sound has spoken with a wedding venue in Gretna, which says couples are cancelling weddings planned for September, October and beyond due to the uncertainty. And it says it's costing the business tens of thousands of pounds. And it's also having a disproportionate impact on Gretna, with so many businesses, hairdressers, hotels, even musicians relying on larger weddings in that area. Gretna's been described as being a bit of a ghost town right now. So I was wondering, when can we expect any update on perhaps larger gatherings for, larger weddings? And going by your opening remarks, is this one of the sectors that's perhaps likely to face disappointment tomorrow?
Well, I'll give a general update tomorrow in Parliament, and I've tried to give an indication of the likelihood of caution in that update and the reasons for that caution. And to go back to the reasons for that, it's because the situation globally and across Europe is volatile, and we've got to be mindful of that, and we want to get schools back. So we've got limited headroom, and therefore, if we do too much, we compromise the ability to get children back to school, which I don't think people want to do. Where we cannot immediately give the go-ahead to sectors of the economy that are still unable to function properly, where we cannot give the immediate go-ahead, we will try tomorrow to set out indicative dates as far as we can, although they will always be subject to change. I absolutely understand how difficult it is. The wedding sector is the one you've mentioned. Cabinet met this morning and had a fulsome discussion on all of these things. Actually, I think the wedding sector in Gretna in particular was mentioned in the course of that discussion. So it is absolutely in our minds. But I come back to the point I made earlier on. This is not just, you can look at any particular issue just now, and if you look at it in isolation, yes, you can say, well, why can't we do X, Y, or Z? And of course, we have to look at everything on its own merits, but we also have to take an overall picture and make an overall assessment. It's the cumulative impact of everything that has the overall effect on levels of the virus. So these are difficult decisions, and it's easy for me to say they're difficult decisions. They are difficult decisions for government. I know the consequences of them are much more difficult for those in businesses or individuals living with those consequences. None of what we are doing right now is done lightly, and I want people to understand that. But it is all part of trying to get the country back to normal safely, prioritising the things that we know need to be prioritised. And there's no greater priority right now than getting children back into education. But I will hope to give more indications tomorrow in terms of possible dates. So even if that is not an immediate signal for reopening for some sectors, it will give a bit more clarity than they perhaps have today. Do you want to say any more just about hospitality? I know you covered it earlier on, but
we're very mindful of the pressure on businesses and on sectors, and our approach over the coming months will be to ensure that we tailor support where it is required. Obviously, the two objectives right now is to enable businesses to reopen when it is safe to do so. We know that that inspires confidence in consumers to return. So actually, in the long term, it's better for footfall if consumers are confident. But the second thing is that where we can, where we have the financial resources, we will absolutely use it to design schemes to provide that support for businesses that are in distress.
Neil Pooran from PA.
Thanks, First Minister. If I can ask about the resumption of cancer surgery, it may be one that the Chief Nursing Officer wants to come in on. A report from the Scottish Government published today says that capacity for surgery is going to be about 60% of COVID levels for the next 2 years, potentially. Clearly, some difficult decisions are going to have to be made about surgery. And I was wondering if you can guarantee that anyone who does need an urgent referral for cancer surgery will receive it.
I will hand over to the Chief Nursing Officer. Obviously, throughout the pandemic, we have been very clear that urgent treatment should still be going ahead. Now, there will be some clinical decisions sometimes that will have been made about balancing the risks of going ahead with a procedure against the risks of exposing a patient to COVID. But urgent treatment generally, but we're talking here particularly about cancer, it should go ahead, and getting all treatment and all NHS services back to normal as quickly as possible is a priority. But within that, absolutely, urgent treatment is the case. But I'll hand over to the Chief Nursing Officer to say a bit more perhaps about cancer in particular.
Thank you. So as the First Minister said, urgent referrals should always have been made throughout the COVID period. Where we know that there is COVID and someone has surgery, and if they contract the infection, we know that their outcome is not as good. So there's two things. First of all, the safety of the patient, and obviously there's then the capacity within our system. What we have learned over the period of the past few months is there are efficiencies we can make, whether it's remote consultations. Now, I know that doesn't substitute for surgery, but we are looking at how we can make better use of our facilities that we have, whether it's out at Louisa Jordan, whether it's our effective diagnostic procedures, and making sure then that whatever capacity we have is safe, so COVID-free. We're looking at how we bring patients in who have cancer in terms of what isolation and testing they would need, and then the surgery there for them. Following up from cancer, of course, people will often need either chemotherapy or radiotherapy afterwards, or indeed beforehand. And again, we want to make sure that that whole pathway is in place. It's our dearest wish that everyone who needs any kind of treatment and care within our NHS gets it. But what people of Scotland need to know is that we're absolutely prioritising those that are urgent and cannot wait. And also those who have cancer, who may, for a period of a few weeks, it's perfectly reasonable for them to psychologically adjust and then come into the hospital. So not everything is immediate and urgent, but certainly we would be expecting to see our cancer patients being treated, and we're doing everything we possibly can, looking at the use right across Scotland of the steps we can take to do that. And that's why we've also looking at reintroducing our screening programmes, because we've got confidence that when people come through the screening programme with a diagnosis of cancer, we should be able to have our services there to support them.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. It was just regarding the return of top-flight football in Scotland this weekend. You'd previously raised concerns that games being played behind closed doors could result in fans congregating to watch them on TV. How worried are you about the new season starting, and what is your advice to fans? Just also, given the progress that's been made in bringing down virus case numbers, are we any closer to having likes of trials with reduced numbers of fans in grounds?
So in relation to the first part of the question, I don't think it was you, Christine, I think somebody else sort of referred to something I said at the start of the pandemic about the concerns of fans gathering if matches were behind closed doors. And I did say that, but perhaps at the time it sounded as if I was stating that a bit more vehemently than I intended to. I don't have huge, it was a factor back at the start in terms of thinking about mass gatherings, but I don't have huge concerns about that as professional sport gets back underway. But I would urge fans to behave responsibly and behave in line with all of the advice, and it applies to football or rugby or any other sport fans just as it does to anybody else. And that is about face coverings, avoiding crowded places, cleaning your hands and surfaces, 2 metres distance. If you're in a pub watching something, then make sure you're complying with all the mitigations that are in place there, and all the advice about self-isolating and booking a test. So whatever you're doing as part of your day-to-day life just now, whether it's going to work or seeing family and friends or watching sport, if we all live by these rules, then we minimise the chances of the virus spreading. And of course, whenever we're talking about organised sport, of course, the police will, have overview of these things and will take any action that is considered necessary. In terms of the second point about trials, you may be able to say more about that over the next days when we update on what's going to happen over the next few weeks. We would be interested in if it was seen to be possible and having potentially trials, but we need to move cautiously and carefully here. One of the things I always talk about in the fact summary is avoiding crowded places, and therefore that has to apply to sport as it does in any other walk of life. So there's a balance to be struck here, and throughout all of this we want to get back to normal, we want to get all sorts of things back to normal, but we have to tread cautiously and carefully, and that applies to sport as much as it does to anything else. Tom Martin from the Daily Express.
Hi, thank you, First Minister. You've touched upon it in your opening remarks and briefly in response to a couple of questions, just on sectors that may be getting indicative dates tomorrow. Overnight, we've seen warnings again of a major chain of health clubs talking about job losses. We've seen a gloomy analysis from the Scottish Retail Consortium of 2 billion worth of lost sales, and they, a lot of that sector relies on passing trade from offices. How much hope do you think you're going to be able to offer some of these sectors tomorrow? Will there be actually really be seeing some light at the end of the tunnel?
Look, I'm going to hand over to Kate in a second about some of the specifics of that, particularly around retail. I want to give people hope. I think there's a lot right now that should give all of us hope. We've been, it's been painful, it's been hard, but we've got this virus to really low levels. But I don't do my job and I don't discharge my responsibility, and ultimately I don't do anybody any favours if I give false hope, or if I get so desperate as I am to get everybody back to normal that I forget about the risks that we face, and then I'm standing here in a few weeks and we've gone backwards. So I need to be really cautious, and I need to take an overall picture and make an overall assessment of the changes that are safe to make, with clear priorities in there. And as I keep saying, getting kids back to school right now is my top priority for the next few weeks. And I again, it comes back to a point I made earlier on in the context of people going on holiday. I make no criticism of any business person in any sector making a really robust case for their own business in their own sector. Of course, I understand that people want to do that, and we listen to that and we try to respond to that as positively as we can. But my duty and the government's duty is to make that overall assessment, and we've got to be mindful of how all of the individual changes add up. And if we make too many too quickly, or if we make the wrong ones in the wrong order, then we will make the situation worse, not better. And that's not easy. And any difficulty I find in that is nothing, I'm sure, compared to the difficulties of businesses grappling with the real life financial impact of this. But as I've said in the past, recovery is really important, but recovery is best served by making a sustainable basis for it. There are so many, you can do a Google search right now and you'll come up with umpteen examples of countries right now that thought they were out of this, that had different parts of their economy open, that are already going backwards and seeing parts of their economy close again and individuals being under greater restrictions again. I can't guarantee we're not going to get there with Scotland, but I want to do everything possible to try to avoid it. And that's why if I'm going a bit cautiously on things, that's the reason. So that the progress, even if it's a bit slower than people want to see, it is forward and we don't risk it going backwards. Kate, do you want to say a bit more about perhaps retail in particular?
Yeah, I am in no doubt whatsoever about the devastating impact that the pandemic has had on people's businesses. And there is an economic incentive in approaching this with caution and making sure that safety measures are in place and businesses can reopen when it's safe to do so. And that's been demonstrated over the last few weeks, where businesses have quite rightly pushed for indicative dates. They've then been able to reopen. But what they're clearly saying is that reopening isn't in and of itself sufficient. They need customers to return, and customers need to feel safe before they return. So I would argue that whilst providing as much clarity and certainty as possible is critical, and that is something that the government is trying to do with the guidance that we're publishing in advance, as well as the route map, even more than that is working with sectors to reopen when it is safe to do so. And I think today's announcement demonstrates again, particularly for hotels and tourism, that the government's not finished when it comes to business support, that having announced at the very beginning an initial response to COVID and the impact on businesses, we are continuing to review the support that's needed to help businesses get through the next few weeks and months. And we won't do that on a blanket basis. We will do that in a way that is tailored to specific sectors so that we can all get through the next few months.
Okay, thanks, Kate. Simon Johnson from The Telegraph.
Hi, First Minister. Yeah, just really following up from Tom's story, we've also had a report out today from the FSB saying that, just highlighting the fact that a third of eligible Scottish workers are having their salaries paid now by the UK government, and saying that we need to get the economy moving again, or there's people are going to be laid off. I just wondered if the Scottish government is prepared for this scenario, basically for a lot of layoffs coming over a relatively short period of time.
Look, we are preparing for what we consider to be reasonable consequences of what we are dealing with right now. I can't magic them away. I don't want layoffs. I don't want redundancies. And we are spending as much time thinking about how we avoid and mitigate and support businesses through this process. I would make a very blunt point here that one way to avoid a cliff edge of redundancies is for the job retention scheme, the furlough scheme, not to end prematurely. And that is, a point that we continue to make to the UK government. There are many other countries that have extended their wage support, job retention schemes, their equivalents of our furlough scheme, way beyond October. In fact, some of them well into next year or beyond. So I think that would be a helpful move, even if it is done sectorally as opposed to in a general sense. It would be really easy, or a lot easier, if we were able just to look at this situation in a very black and white way. Let's just concentrate all of it on public health or all of it on the economy. I've got to try and find the best balance possible. And I know this is really difficult for people, but if we move ahead so quickly, and we are getting the economy back to normal, it's compared to a month or 2 months ago, of course there is much more normality. Pubs are open, restaurants are open, shops are open. So it's not the case that we're not moving in that direction. But if we get the pace of that or the ordering of that wrong, the real risk, and it's not a hypothetical risk, as I said a moment ago, you can see this happening in some other countries, we end up going backwards, and pubs that are open today will be closed again, or restaurants, or whatever part of the economy we're talking about. So this is a really tricky balance to try to strike, and I know that some people would want us to go faster in the economy. There are other people who would say keep everything shut down because we should just be making sure that we give no chance for this virus to spread. In my position, I've got to try to strike a balance there, and I'm not going to keep everybody happy. That's been the case from day one, but that's why I've tried to focus totally from the standpoint of what gets the country through this crisis in the safest possible way, and that's what I'll keep doing, and try to make the best decisions I can. No doubt getting it wrong in some occasions and trying to put that right and learn from it in future, but make the best decisions I can at any given time. Rachel Watson from the Daily Mail.
Thank you, First Minister. It's been reported today that the UK government is looking specifically at Belgium, Luxemburg and Croatia for bringing back quarantine measures. Can you tell us if you're thinking the same for these countries, and do you have specific concerns about them? And is there any other countries that you also are concerned about? And what talks are you having with the UK government about this at the moment?
I'm going to refrain from mentioning countries at the moment because I don't think it would be wise or helpful to do that before we take decisions. We see the up-to-date data today, and there is a Four Nations discussion this afternoon, which from that discussion I would imagine any decisions that are going to be taken about adding any country or countries to the quarantine list will be taken in the course of that Four Nations discussion. So it may well be that we see some further decisions this afternoon, but obviously I don't know that for sure until the decisions are taken. But that Four Nations discussion is scheduled for later today, and that will look at the up-to-date data. Tom Peterkin from the P&J.
Good afternoon, First Minister. I know you said that Cabinet met this morning. I'm just wondering if you can confirm that a decision was made to press ahead with full-time opening of schools rather than the blended model. And I also wanted to ask, will face masks come into play in terms of the mitigating measures that will be needed when children come back to school?
As you know, Tom, I'm due to give a statement to Parliament tomorrow in this slot, and I'm duty bound to announce these decisions to Parliament, and I'm going to do that to avoid the risk of getting into trouble from the presiding officer. I think you know where we're trying to get to in schools. I think you've probably not heard anything from me today that would suggest we're going in the opposite direction, but I'll announce the detail of those decisions to Parliament tomorrow as is appropriate. Gina Davidson from the Scotsman.
Hi, thanks, First Minister. Can I just go back to the BBC disclosure programme last night? In it, it was alleged that care homes felt pressured by the government to take in people from hospitals. And I just wonder whether or not you think that's an accurate view of how things played out, and if not, why maybe they felt that. And could I also ask, from that programme, it was suggested that the government was being told that masks should be worn from about March in care homes, I should say. And I wonder, you've been very cautious about everything around coronavirus, and I wonder why your instinctive caution maybe didn't kick in around that and you didn't introduce that earlier.
I'm not sure that is a fair characterisation. The Chief Nursing Officer may want to say more about this. On the two issues, the number of people who've died in care homes and the way this pandemic has affected care homes, and I'm no different to anybody else, it breaks my heart and deeply upsets me in the way that it will anybody looking at this. And there are real questions that all of us need to ask about what was done, why it was done, and whether we could have done things differently, because we may be facing a further challenge from COVID down the line. So I'm not in any way, far from it. I've never been less defensive about anything before, because it's so important that we don't get defensive about these things, because the need to learn these lessons is so vital to all of us. I think the one point I keep making is, and this is not, it is entirely possible that straightforward mistakes were made. And if that's the case, we all have to recognise that and be accountable in the normal way for that. But much of what we are talking about right now, when we cast our minds back, some of it is based on knowledge that we have now that we didn't have then. I wish we had it then, but I don't have that ability to turn the clock back. When we talk about discharge, remember that what we're talking about here are people who had no medical need to be in hospital. And until COVID, most of the pressure that governments like mine are under is to reduce delayed discharge, to not have people in hospital when they don't need to be there. Coupled with, at the start of COVID, a real fear that all of us had that our hospital system was about to be overwhelmed, and therefore we needed to have as much capacity for COVID as possible. And also the view that a hospital for an older person who had no medical need to be in hospital was not the best place for them when the hospital might be about to be filled with COVID cases. So that was why we did try to get people who didn't need to be in hospital into more appropriate settings. So the idea that there was pressure, that's what was going on at that time. Now, you can look back now and think that was right or wrong or whatever, but that's what was happening at that time. And, back then, like most people in positions like mine, the world over, was losing sleep over the fact that our ICU and our hospital capacity was going to be totally overwhelmed. Thankfully, that didn't happen, but we can't be complacent about that in the future either. And of course, people were not simply discharged into care homes with no thought. There were clinical risk assessments done. There was infection prevention and control guidance in place for care homes. So there was a lot of thought and a lot of care taken. But of course, we have to look back and think, if we knew then what we know now, would we have done things differently? Because we are not out of this situation yet, and we may face similar decisions again in the future. On the issue of face masks, there was UK wide PPE guidance for both health and social care workers, which was published in April, and it was then updated, I think, on the 12th of June, and Fiona may want to say more about this. And the change that was made there was that it was basically all members of staff were told that it was up to their own judgment whether they wore face masks, even dealing with patients that didn't have COVID. But the idea, before COVID, there has been guidance in place for the use of PPE in hospitals and healthcare settings. So the idea that COVID simply necessitated that and it hadn't been there before is not the case. So at all points we have had guidance in place, and where there has been evidence that that guidance needed to change, we have changed the guidance.
Thanks, First Minister. So I watched the programme last night with sorrow and the deepest respect for the relatives who were bereaved and the staff who were represented on the programme in terms of recounting their distress at what was a distressing and unpredictable circumstances that none of us had ever faced before. When people are discharged or returned back to the care home, then that is done in partnership with the local social work department. The care home would need to agree that they had an appropriate area, so room for the person to stay and appropriate staffing, and the ward themselves would need to agree that the person was ready and fit to go to that care home. And in line with whatever happens, there's strong partnership working, and therefore care homes are part of our health and social care system, who know how important it is to return either the resident or, if someone is new to come in, then rather than be in a 4 or a 6-bedded hospital ward, to actually be in a care home with their own belongings around them is a much better environment for people to be in. The mask situation that in care homes was the same as it was within our NHS. So health and social care staff during March were advised to wear masks when caring for people with overt COVID symptoms. So that changed in April to all health and social care staff wearing a mask at all times. And then the further advice in June that was given was about the care home manager, perhaps, who's in an office, who would be walking through the care home, also then having to wear a mask. So that was being ultra cautious and ultra precautionary there. But the same guidance was available for health and social care staff. It was about wearing masks, as well as the other transmission-based precautions. And as the First Minister said, our care home staff are expert at dealing with flu, with winter vomiting. So the notion of infection prevention and control is something that they are very confident in. This was different, it was new and it was learning, and that's why now we're working in partnership with Scottish Care, with our local authority colleagues, with our health and social care partnerships, Care Inspectorate, to look at what actions were taken, what was the outcome, and in practical terms, how can we go and improve that and make things better for what we hoped will be a post-COVID, but certainly during this, so that we're prepared for any, whether it's flu or a second wave over the winter.
Thanks, Fiona. Tom Gordon from the Herald.
Thank you, First Minister. You'll be aware that the opposition parties at Holyrood have been complaining about these briefings themselves. Not the fact that the briefings are happening, but the fact that they're broadcast at length on the BBC, and they would like those to come off air. I just wonder what you thought of that idea, given where we are in the pandemic. And do you think they have a point when they say that occasionally these briefings are politicised? I appreciate that we in the media often try to move you on to fresh subjects, but this briefing did start with the Finance Secretary raising a long-running beef about borrowing powers for Holyrood, which long predates COVID. So do you think, even if you don't agree with their remedy, do you think the opposition have a point about politicisation?
I think, I'm a reasonable person, as you know, Tom. I always try to see things reasonably, even although I don't always agree with points that are being made. I think people watching can make their own judgments about whether I have in any way tried to use these briefings as a political platform. I've on occasion actually refused to engage in questions that I judged were taken as into political territory. Some things, you know, one person's political issue is another person's very legitimate issue, part and parcel of dealing with COVID, and the fiscal flexibility of the government to deal with the overall consequences of COVID, I would put into the latter category. I accept that others with a different view of that will see that as political, but the idea that our ability financially to deal with the economic impact of COVID is not a part of the handling of this, I think doesn't bear much scrutiny. I think these briefings are important. We are not out of this pandemic yet. This pandemic, to use the language of the World Health Organization, is still accelerating globally. We're in a very good position, relatively speaking, in Scotland right now, but we cannot take it for granted. We are still living with some lockdown restrictions. We are going into a period over the next couple of weeks where we hope to get schools back. And part of my biggest concern right now is that there are things all of us can do to keep this under control that we're all maybe getting a bit lax at doing. So for that reason, as well as the ongoing issues we're dealing with, I've indicated today that there may be a cluster of cases in Greater Glasgow and Clyde, our biggest health board area. The provision of updates and information, but also the ability to stand and look down this camera and give people the advice that we all need to follow to keep this pandemic under control, I think is really important. And it continues to be important because we are not out of this. The risk hasn't gone away. It's clearly not my decision what broadcasters do, but I do think there's a real public interest in all of this. And I will continue to do, I'm trying to strike a balance here between, I don't want to talk about politics here. I've sort of refused to do that on more occasions than I can remember right now. But I'm also trying to strike a balance between not doing that, but doing the courtesy that I owe to journalists of answering the questions you pose to me. So, I might not get that right at every occasion. I'm not perfect. But, I would say to the opposition, in the middle of a pandemic, at a really crucial stage of this, when the difference between continuing to go in the good direction we're going in or going backwards is so finely balanced, criticise me and find other ways to criticise me. That is fine. I don't mind that. Well, sometimes I mind it, but that's part of my job. Don't try to undermine the public health messaging that we really need to still get across to people. And I make that as a genuine and honest plea to my political opponents. Kieran Andrews in the Times.
Thanks very much, First Minister. Historic Scotland has said it will be reopening Edinburgh, Stirling and Urquhart castles on August the 1st. The Times has been told that it has banned all group bookings until the end of the year. How badly will this affect tourism and Scotland's economic recovery, and what support will be offered to tour operators and coach companies who now effectively need to write off 2020 for their businesses?
I'm going to let the Finance Secretary address that point.
Two parts to that question. The first is around ongoing support, and I think I've made clear in my comments already today that we will continue to look at how we target and tailor our support to specific sectors, and tourism in particular has been hard hit. Some of those businesses that you mentioned have probably benefited in part from financial support to date in terms of the grants, furlough scheme and other things, but clearly the tourism industry is talking about 3 winters in a row, and we will continue to look at how we provide that support. But in terms of the wider point about reopening, this goes again to the heart of a point I made earlier, which is that we want to enable those world-renowned tourist destinations to reopen. We want to give them clarity and certainty. We want to ensure that visitors have a positive experience. But that will be even more positive if they have the confidence that when they go, precautions have been taken. And to that end, I know that a number of the organisations you mentioned and many, many others are looking in careful detail at how they implement the social distancing, how they make sure that there's clear guidance for those that are visiting as to what will be expected of them. And actually what we're finding is that if would-be visitors have the confidence knowing that people will be following that guidance, they are far more likely to go in the first place. That is good for trade, that is good for our economy, and it will ensure that some of these businesses and organisations that have been hard hit can get closer to normal.
Thanks, Kate. Paul Hutchin from The Record.
First Minister, do you have any concerns about students from other parts of the UK or from overseas coming to study in Scotland if they're coming from places that have higher rates of coronavirus?
Well, let me say first of all, we want students. Our university sector is amongst the best in the world. We want Scotland to be a place that students want to come and study here, whether that's from other parts of the UK or internationally. But the risks of importation of this virus are very real, and they are, as I said yesterday, higher now than they've been at any time since the start of lockdown. So it is something we will be discussing with universities about the precautions that need to be taken to minimise the risks of that. And like everything else around this, we will recognise the risk, and then we will work collaboratively to try to make sure that we're doing everything possible to reduce that. So all aspects of this, often these questions are prefaced by, am I concerned? I think you can take it as read that I'm concerned by all aspects of this, but there are balances we need to strike, and there are mitigations that we need to ensure are in place, and we'll continue to have a close discussion and dialogue with universities and colleges about that. Tom Magner from Carers World Radio is the last question today.
Thank you very much indeed, First Minister. Our viewers welcome the inclusion of care homes in the new NHS Pharmacy First Scotland scheme. But how confident are you that pharmacies and care homes can work well together locally and very quickly? How secure and sufficient is the funding? And given what you've said on the BBC's programme on care homes, it could be seen that all was fine before COVID-19 struck. Do you have any regrets to express direct to those of our viewers who had long-standing worries about Scottish care homes? They say long before COVID-19, through conditions and decisions into a very raw focus.
Obviously, I don't know specifically what you're referring to there, but I take the view that anybody, whether in a care home or a hospital or any part of the public sector that my government is responsible for, that feels let down or has a bad experience, then yeah, I regret that, because that's not what I want to happen, and we try to learn lessons from that. I do think the point about not seeing some of the things that we have had to absolutely change and adapt to because of COVID, we probably should have done that before COVID. I use the example sometime of the Near Me video consultation system that we've been trying to get rolled out across the NHS for a long time. COVID meant that was done over a matter of weeks because the necessity of it really speeded up the progress. So there's a sense in which when we are out of this, we have to reflect on the things that COVID made possible that previously seemed impossible, and work out how we can maybe capture some of, I don't like calling any aspect of this positive, but some of the positive learning as opposed to the negative learning. And the new pharmacy service that I announced yesterday is another example of, we've always known pharmacies can do much more in the community. They've got to absolutely make sure they're following all the guidelines right now about minimising the risk of COVID. But yes, there are many things that we can learn about from COVID, and some of that will be learning based on mistakes we've made. Some of it will be learning about actually things that we always thought were really difficult to do. When you actually have a driving necessity to do them, you can find a way to do them. So we should make sure that we look at it from both of those perspectives. That concludes the questions for today. My thanks to Kate and Fiona and Yvonne, who has been our BSL interpreter today. Thanks, as always, to the journalists, and thank you to you. I finished my answer to Tom there by saying when we're out of this, we need to look at all of these things. We're not out of this yet, and that's the note I need to end on. The progress we're making continues to be really good, but there are lots of signs of fragility, not just here, but overseas right now, that must make us stay on our guard. So please, think about your own interactions and your own personal behaviour as you're going out and about and to do with your daily lives just now. And if you have been finding that maybe you're not being as careful as you were a few weeks ago, try to rectify that. I know I will be doing that as well, so it's not just me telling you to do things. We're all in the position where we need to do that. I'll be joining you from the Scottish Parliament tomorrow. I will I think at 12:20 tomorrow, there'll be a statement updating on the route map and confirming the decisions we're going to be taking over the next 3 weeks. So I hope you can tune in then. In the meantime, please stick to the facts advice, and I will just end as I always do by summarising what that is. Face coverings, avoid crowded places, clean your hands and hard surfaces, keep 2 metres distance and self-isolate and book a test if you have any of the symptoms. Thank you very much for joining us today, and we will see you tomorrow, albeit from a different location. Thank you.